health anxiety or hypochondria derives from a fear that one is ill, or one's health is threatened in some way, to the point that they can't lead a normal life, to the point that they keep repeating going to the doctor, have a lot of self-checking behaviors, and ultimately it leads to a real disruption of their day-to-day life. I think the worry always is with a hypochondriac is there's always another test to do. What I say to my patients, one of the important things to avoid is personalizing everything. You know, there's something called medical student's disease. In their first year of medical school, every student goes through a phase where they think they have everything, or their cousin Bob has something, or their aunt Mary. So everything's personalized because you read about so many things you haven't heard of. We live in such a media culture today, and I think the internet really doesn't help. I mean, you could potentially put your symptoms in and come out with everything from, you know, a scratch to you're going to die in a week, and a little bit of knowledge is a really dangerous thing. So take that on board. You know, if you're not medically qualified, then odds are you're reading way too much into these things. Secondly, once you've got to ask yourself that, you know, if I'm going to reassure myself, it needs to stop somewhere, because it can become, reassurance can become almost part of the problem. The more you reassure, the more you seek reassurance. So you need to say to yourself, all right, once I've had the health check, if everything's okay, then I'm going to go back to living my life, and I'm going to stop checking for whatever it is I'm checking. Thirdly, if you can get in the sense of control by doing your breast self-exams or your cervical smears, then that's great. And, you know, tick those boxes and do that. But in between, make sure to live.